This is Psyched for Sanity. I am one of your co-hosts, Dr. Tara McKelvey Parker. I'm a licensed clinical psychologist in private practice. I specialize in assessing and treating complex trauma and attachment wounds from childhood.
And I'm your other co-host, Dr. Brendel Doss. I specialize in geriatric psychology, forensic psychology, trauma treatment, and assessment. And boy, do I have a story for you today.
I am excited for your story.
Buckle in. Good job.
Buckled.
For those that are just listening, she literally buckled herself in because she knows I'm serious.
Imagine.
I have been teasing her with this story about my child for about 2 weeks now, and I have been refusing to tell her because I wanted to see her genuine reaction with all of you.
Driving me bananas, and also I'm probably not going to have a big reaction at this point. I'm going to be like,
you're probably like, that's
really?
ridiculous. You're going to like, wah, wah. Yeah.
We'll see.
Okay, so the other morning.
Okay, morning.
My spouse goes to get our 5-year-old. We have a 5-year-old daughter that is a unique individual and a diamond in her own right. And you never know when you wake my daughter up what you're going to get. So my spouse goes in there and greets her, good morning, honey. How'd you sleep? All these things. And she's been sitting up. She's awake. She's not waking up.
Okay.
She's sitting up.
She's awake.
She stares at my wife and says, I'm not the child you're looking for.
I love that. She's so crazy. What happened after that?
Obviously, my spouse brought her down to me. We got her dressed, tried to get her ready because she had to go to school that morning.
What are you talking
But literally, she came down and told me, and I'm like, did you let her watch a horror movie or something? And of course, my spouse was like, no.
It's like slightly creepy, and I could also see it being a little like playful, like.
But she was
I'm not ready to get up.
Apparently, I was not there, but it was like a deadpan. One of my daughter. One of her deadpan faces. I'm not the daughter the child you're looking for. And I'm like, holy mackerel! Who do we call a priest? We're not even Catholic.
Creepy.
Like it was so creepy, so creepy.
That's pretty funty. That's never. I'm trying to think about when I wake my daughter up. She's usually pretty good. I don't know. We'll see how that.
Every morning is an adventure. Sometimes you'll get animal noises.
Really?
Yes. Sometimes she's like an animal of the day. That's happened a lot. And she refuses.
Right,
or sometimes she says,
up.
I'm not. She'll say, I'm not so-and-so. Like, I'm not my name. I'm Mr. Well, my wife has nicknamed her the No Noodle Poodle.
The No Noodle Poodle.
I think for a while she was refusing to eat noodles. I don't remember. I don't honestly remember how that started. But you never know when you wake my kid up what you're gonna get, and that's what we got about 2.5 weeks ago, 3 weeks ago.
That's pretty funny.
And
I don't
also like scary.
Well, yeah, no, that's a little creepy for sure.
And I don't even like horror movies.
And I do, and I'm like,
don't.
yeah, that could definitely.
I don't watch anything beyond Abbott and Costello's Hold That Ghost. I'm out.
What?
I don't do anything. That's a very old movie that you don't even know because I'm an 80-year-old man.
Indeed.
And so you will never get that reference. And
I'm
if
glad
you do,
you're accepting it now.
Hey, fellow older adults, it's me. I'm here with you. I just don't do anything scary whatsoever. So this was specifically shocking for me. And I'm like, what on earth literally possessed her to say this? We have no idea. She never has said it since then.
Okay.
So there's
well,
that. But if anything happens to me, guys, you will know what happened now. If I go missing.
Oh my gosh. Yes. You need anyway, that reminds me of a podcast that I watch or listen to where they're always like, you need an if I go missing file just in case. And in this case, it would be if you're a child.
I don't know. I don't know what's going to happen. And then the question becomes, what child are we looking for and where did you take her?
Well, that's what I'm wondering.
I have no idea. Yeah.
Okay. Well, yeah, I mean, kids are wacky.
Crazy.
As we often talk about on this
we do
podcast. And, and thinking about what we wanted to talk about today, we are still, in the thick of parenting
always
challenges.
Yep.
Often they are hilarious and challenging and,
sometimes in the same moment.
Exactly. So we wanted to talk a little bit about gentle parenting as a concept because it was something that both of us have heard.
Yeah, we've heard it.
Right. And I think it's a confusing one.
Right.
For parents and people alike. What does it actually mean?
Right.
Like, why is it so hard to use in day to day? And is it actually helpful?
Well, and I think, and this is just my opinion, I really had a lot of misconceptions about the title, and in my head before we like dived into the research on it, it was like I'm definitely not a gentle parent. I'm definitely
Yeah, you said that out loud. You're like,
I was
I'm not a gentle
I'm not a
parent.
gentle
I'm like, I
parent.
think you probably are
not.
more than what you
So
realize.
I even had the misconception of what gentle parenting was before the research, because it doesn't.
The term doesn't naturally
sort of
lend.
with
The label doesn't naturally
construct.
connect with what it actually is.
Yeah.
So we wanted to go through it because, we've talked a bit about attachment too on this podcast. And, I think many of these principles that go with gentle parenting promote secure attachment, and
which we would all love for our kids to have.
This is good. This is
want this.
the gold standard. We want to have healthy, secure relationships with our kids. So we thought we'd kind of cover this one because it's important and also I think confusing. And many of us are just trying to parent differently potentially than we were, or trying to give our kids emotionally what we didn't get, and it can just be confusing what to do, overwhelming and like feel really easy to feel like you're failing or doing something wrong. There's just a ton of parenting information.
So let's start at the beginning. What actually is gentle parenting?
Well, I'll tell you, it's not being gentle all the time.
Spoiler alert.
It's not about gentleness necessarily. So there are some core sort of principles.
Yes.
One is connection before correction.
Right.
So the idea is that a dysregulated brain is harder to learn.
Right.
Can't receive correction as well when we're in the thick of big feelings or big emotions or, whatever. So we want to connect before we correct. So you're angry. I get it. I'm still not going to let you hit.
Right. Well, and also it's like, if the goal is, I don't want my child to do this behavior, and if they're not in a place to hear and receive that feedback, they won't change the behavior. So that kind of punishment mentality, you have to basically do the teaching before there's like any awareness.
That's another one of the big...
happen, not the connection.
It will not happen without a calm brain.
Right.
So, connecting with your child first will help calm them down.
Sure.
Also, validating emotion, I think, is something that we all kind of crave and need to feel calm and connected. Even if you don't agree with the hitting or the behavior, right?
Well, you're not supposed to agree with that.
Right. You can still totally validate you're angry, you're disappointed, you feel jealous.
Right.
That makes sense.
The emotion is always true and accurate, but not the full perspective on reality.
Right. You don't have to agree with your child to validate their emotion.
Right. Or
Those
anybody.
Or anyone. Right. Yeah. Exactly. So emotional validation and connection, these things can help our kids calm down, so that we can focus on teaching skills over punishment. So it's a big concept in gentle parenting that, punishment, it can kind of if we're punishing misbehaviors, it can miss the point, rob you and your kid of a moment of trying to teach a skill.
Right.
So like, your kids are just trying to develop skills around emotion regulation, around attention and executive functioning. So we want to teach over punish.
Right.
What else?
I think with gentle parenting, the title is, again, like misleading, but I think the other things in gentle parenting that we've talked about in terms of the core would be, it's not no boundaries at all. That's sort of like a misconception. Mm-hmm. It's firm, consistent boundaries, without shame or guilt.
Yeah. Yes, exactly. Intimidation or humiliation. Like, it's not permissive. I think that's a common...
huge misconception.
A common misconception is that gentle means we're always gentle, or we're always sort of letting our kids lead, or we're never upsetting them, or we're never setting limits. That is not true at all. Yes, but you're right. We want to do it. We want to set limits respectfully, as calmly as we can, and without shame and fear.
So, I think when I thought of like gentle parenting, it was this really permissive style of child-led, and there's no consequences of behavior. But gentle parenting there are logical, reality-based consequences for choices without rescuing or minimizing emotion. Right. And that's a big part of, I think, like the balance of it and the core.
Right.
It's that consistency and that engagement with limits.
Exactly. Kind of like that story I told, on one of our episodes about child development. Whenever my daughter was like screaming over a piece of cheese, like, I know you're really disappointed and upset and you
Right.
really wanted that. We're not getting another piece of cheese, and I tried to do that as calmly as possible while,
Right.
sort of trying to stay calm around this
Right.
meltdown. But,
Sure.
and that's co-regulation. So another
That's a big part of it.
core component of gentle parenting is, understanding that developmentally younger kids really do need co-regulation. So the way that they cope
Sure.
and deal is really by you staying calm, by lending your calm, by staying close and containing the big emotions.
And you mentioned younger kids. I would even remind folks that kids need co-regulation up to what we talk about, like 12-ish.
Yeah, I'd say definitely the first 5 years. After that, I think some of this stuff starts to get a little bit more internalized, but certainly,
There are moments when they still need.
well, I think we kind of always need,
That's fair.
to an extent, someone who's calm and warm
Right.
and loving and is like, yeah, I'm here for you.
Sure.
I got you. And I think at the
Yeah.
end of the day, that's
Yeah.
one of the core components of gentle parenting. So it's, all of this sort of these emotional pieces, teaching skills, viewing, respecting a kid as like a whole person. They're not
Yes.
just like behavior to control. They're developing little personalities, that are really unique. And
Right.
so,
Respecting, I think, is often misunderstood in general, but I think within gentle parenting, my idea of it is actually in line a lot with what I believe from my personal
yeah, you've talked about this
parenting
before.
experience. I think a lot of the time parents exist in the world where they expect their children to act and behave in a way that they do not model. And that maybe
That bothers you a lot.
it bothers me a lot.
The
It does.
hypocrisy of it.
Professionally and it's so hard because I hear stories from parents and things like that, and in my mind I'm thinking, this doesn't really feel respectful of a kid. And that doesn't mean, when I use the word respectful, I want to be clear. It doesn't mean that I think a child should be equal to you, but it does mean that a child is not dumb, they're just young. And they're a person, and they're going to develop into a full autonomous person very, very soon. Time goes by fast, from my experience in parenting so far, and I heard it only accelerates from here. So why would you not want to set the groundwork for respecting and, showing that modeling? Because if you want them to be respectful and model it, then why are you using anything but respect and modeling it to them? And
Yeah,
that's a big part of gentle parenting.
Yeah, and to sort of jump on that, I do think gentle parenting is like a newer term,
Yes.
a newer movement, a newer concept. And this is why I think many of us, I think we resonate with this kind of parenting style because we may have been parented in a way where there's a hierarchy
That wasn't
a
gentle.
bit, right? It wasn't gentle, or like, it's sort of seen and not be heard. Like,
as I say.
respect, do as I say. Respect is like sort of paramount. Like,
And asking why is disrespectful.
yeah, like some of them,
Sure.
I think, right? So we're trying to do it a little differently. And I think sometimes, speaking of permissive, we can overcorrect.
Right, that is not gentle parenting.
It's not gentle parenting, but some, we're trying to do, something different. We want to be emotionally sort of available. We want to be gentle. We want to be understanding.
Right.
We want our kids to have emotion regulation
Sure.
skills. And sometimes I think people then think they need to overcorrect.
Yeah.
And then it leans more permissive or more child-led. And that's when it becomes hard,
There
I think.
are other challenges of that. I think
sure, yeah.
the way I would frame it
Yeah.
to kind of like is I want to always make sure my kids, even at the young age they are, I have 3 and 5 right now, even at the young age they are, I always want to make sure their voice is heard, and I want to try to listen with some level of calmness and regulation. And at the end of the day, I still am going to make decisions for their best interest as a parent.
Yes.
And I'm going to be honest that, right now, it's not a good idea that we have cake for breakfast. I
Yeah.
really appreciate you asking. Like this morning, daughter woke up and asked for a mango bar because she saw a mango wrapper from a mango bar on my bedside table that I did not hide soon enough.
She's like,
So she's like, I want a
that.
mango bar. And I said, that's a great
Ooh.
idea. I thank you that's a great idea. Let's have one after dinner tonight. And she's like, no. I said, let's go work on our dinner. Let's go work on our breakfast.
Yeah,
And
it's
we'll
breakfast
have that this evening.
time. We'll have mango
So that's,
bar later. Yeah.
child-led would be giving her the mango bar this morning when
Yeah.
I don't really think it's a great idea for her to have that much sugar without having more protein or other things. That's just my
Right.
personal decision as her parent.
Right.
And that's just a really microcosm example of I validated she liked it. I appreciated the request I heard. I didn't yell at her and say, you can't have one right now or that's not for you. Of course she wants a mango bar. That makes a lot of sense. They're delicious. But it's just not going to happen right now.
Yeah, exactly. So those kinds, that's a good example. So I think a lot of us know this,
Right.
and we like aspire,
Sure.
I think, to do some of this with
Yeah.
our kids, but it's hard. So, why do you think it's so hard? Why
Gosh,
do you
it's
think
so
it's
hard because and I say we, I think I had elements of gentle parenting in my experience in my childhood a lot. But I think we as a collective, I'm an old millennial. I think in that generation, we are trying to do something in gentle parenting that we have never seen or experienced before in our lives and in childhood.
Yeah,
And so
lots of us didn't.
It's really hard to do things when you have no model whatsoever.
Yeah, no blueprint.
For how it should look and feel.
Yeah, and I think, it requires regulation.
Which
and
is also
emotional work, yes,
a
on
newer
yourself.
construct in the social lexicon.
Yeah, and that's really hard. I mean, we're asking you guys to stay calm.
Or you're asking this of yourselves if you're doing gentle parenting.
Right, or validate experiences.
When no one validated yours.
Right. Or to sort of have developmentally appropriate expectations.
So hard.
These things are really hard to do,
right?
And I think that's one of maybe the more common misconceptions about gentle parenting is that you have to stay regulated all the time, or you have to always be gentle,
No.
or your kids are not going to have big reactions.
Right, that's a huge misconception that gentle parenting is going to erase a tantrum, or kids aren't going to have big feelings.
I really do think, a lot of parents sort of I think the hope is that the behavior stops, that the feeling stops, right? We want to parent in a way that makes it such we don't have any of this stuff because it would be easier, right? Without the meltdowns and the big feelings and things like that. But even gentle parenting is not about not having meltdowns or endless validation or endless empathy or endless patience.
It's about a framework of a secure attachment, which is boundaried, consistent, reliable,
warm,
responsive.
And so you're setting limits, kids are going to be
upset about
angry.
That. And tantrums are developmentally appropriate at certain ages.
Right. You're still
big feelings happen.
You are practicing this kind of parenting. You're absolutely going to lose your patience. You're going to be invalidating sometimes. You are going to probably think things that are not necessarily appropriate, and your kids are going to protest. They are going to get dysregulated. They are going to have hard moments.
Sure.
But you're trying to lead with connection. You're trying to be warm and boundaried.
Right.
You are trying to repair. You're trying to have developmentally appropriate expectations and teach skills, even in the midst of when things are imperfect and when they're messy and all of that. So,
you know what thing that makes it hard, since this is sort of not born on the internet, but is definitely, there's a lot more conversation around it on the internet.
A lot more, yeah.
Social media and the internet has really made it so, I think it's helped it.
Yeah,
and
definitely.
Because it's kind of communicated more to more people. Yeah,
more people. Social media about parenting in general. I get so much of my information still from.
Right.
Yeah.
But I think it also creates an inaccurate perception at times of what it functionally is.
Mm-hmm.
And it can lead to you feeling like I'm not doing a good job at this, or that my perception was I'm not doing it. But
I'm not doing that.
I don't do that. That is not me.
But
that's inaccurate, because at its core, I 100% feel like with the constructs that we've talked about that I do that.
That we're mostly doing that, but we are not endlessly patient, endlessly empathic, endlessly calm. That's, and there's still our kids are still very upset, as you probably can tell on this podcast. We talk a lot about them being upset and
they're allowed to be that. They're allowed to be upset.
Yeah. So I think this is true. I often, because I follow a lot of parenting sort of, influencers or whatever, and they'll have these sort of calm scripts, these scripts for what you can say.
Sure.
This gets me often. A script for what you can say in this moment.
Right.
And then I get hyper fixated on what this script is saying. And I'm like, wait a second, that is not helpful for me in this moment, even though the concept is good, but that's too simple. That's not going to work for my kids.
And that's where I think while the scripts can be helpful, I think viewing them more as not scripts but guideposts.
Guideposts.
And that's where and I think I'm hopeful that parenting influencers or mental health influencers in this space, and a lot of them do acknowledge that their lives, what they put out there, what they share, is only part of what you see. I think if some parenting influencers might put out their kid's worst tantrum, I think they might get some pushback for that.
Yeah.
But I think those tantrums exist, and some of them do talk about how this is not always how it goes. You know what I mean?
Yeah, yeah.
Social media is just one part of our lives that we're choosing very intentionally in an edited fashion to put out in the world.
Yeah, exactly.
And not the whole picture of reality.
Yeah. So, I think, what are some other I think we've covered many of the common misconceptions about gentle parenting. I think, can you think of some others? I've got a couple more.
Misconceptions?
Yeah, misconceptions about gentle parenting.
I think that you're never supposed to, become dysregulated yourself. Mm-hmm. Or that you're never supposed to have intense emotional reactions to things. That was a common misconception that I had.
Yes, because you're I'm not gentle.
That's why
lose my patience way too much for being gentle.
I'm not gentle. No, and I think it's okay to show children how their behavior impacts you and developmentally appropriate, safe ways. Mm-hmm. I've run into this a lot where parents think they're not supposed to have any emotional reactions to their kids. And I'm like, that's not reality based. I always tell people, in 10 to 15 years, how do you want them to treat their spouse? How do you want them to treat their boss? It's okay to let them know in the developmental context. Mm-hmm. This really bothered me. It's not okay to hit. It's not okay to hit me. It's not okay to yell at me. Mm-hmm. I don't appreciate that. Mm-hmm. You know what I mean?
Mm-hmm. Sure.
I think communicating about the experience is important.
Yeah, and I do think kind of just yes. I think for me, when I thought about gentle parenting, I thought about it means you never upset your kid.
Right.
If you're gentle enough, if you're doing these things,
sure.
It means your kid's always okay, or they're
right.
never really upset. And I'm like, that's a really big misconception. Another one, I think too, that parents get really hung up on is just this idea then that we can't ever leave our kids distressed.
Oh yeah, big one.
Right, it's not okay if they're upset or we go or we leave. And we talk a bunch about co-regulation and staying near and being calm and containing, but the reality of the situation is sometimes when I'm busy and I have other things to do, or there are multiple kids around and your attention is divided, you are not able to stay nearby while your kid is rolling around on the floor. And it's okay if you walk away and they're not okay.
Well, and I think the world is not going to constantly attend to their feelings.
Yeah, I mean, the hope is that you're doing it well enough at home. I think I've said this stat before, but 30 to 50% of the time.
Sure.
30 to 50% of the time is what the attachment research says. If we're doing, these things 30 to 50% of the time, then we're doing pretty good, and that includes repair, not perfection. So even in this 30 to 50% of the time, if we're losing it, right, or we're having unrealistic expectations, or we are leaving our kids in distress, but we're repairing,
right,
and we're saying what we need to be saying to take responsibility and to try better next time and
take accountability. Sure.
All of that stuff is included.
Right.
So repair over perfection. So, what can help then? What can help us be more gentle if we're, in the context of what it actually is? If we want to be a more gentle parent and promote and foster more secure attachment, then what can be helpful?
Yeah, I think always understanding that this is new and different if this is not how we were parented is one. Mm-hmm. I think maybe, looking at and realizing that, you talked about the scripts that we find on social media and on the internet might be helpful, but they might not be a perfect fit to come out of your mouth or to be coming out of your experience with your child. I always tell my patients and my clients, this is how I would say something or do it, but you need to be able to have your version of this, otherwise it won't work. Mm-hmm. So I think your version of whatever that regulated state is for a script or a dialogue with your kid.
Right.
And owning it yourself.
Yes, I think another big one, because this parenting approach requires, really leans a lot on this sort of emotional care, that we have to be taking very good care of ourselves.
Yes.
So that we can stay as calm and regulated as we can.
Yeah.
Right? Or at least have the wherewithal, the kind of just pay attention to what's triggering you, right? Mm-hmm. What's making you overwhelmed or extra irritable or whatever. And so that you can be thinking intentionally about, okay, what's going on with me or what's going on with my kid? Mm-hmm. what needs to be adjusted.
Sure.
And then making sure that you're taking care of, self-care is very, very, very important.
All the
because
time.
we lose it way more often when...
It's easy to be overwhelmed by kids' behaviors, even
Yeah.
if they're really developmentally appropriate expected. So,
Exactly.
I think kind of zooming out on this conversation, I'm just taking away, how hard. I feel like this is one of my common reframes.
You're like, everything is hard.
A lot of things with parenting are hard. Excuse me. Everything is hard. A lot of things with parenting are challenging and I think really rewarding at times.
Yeah,
But
definitely.
it's actually kind of like comforting in a weird way for me to realize, oh, maybe I am a gentle parent.
Yeah.
Maybe I am like gentle parenting when I thought I was like, doing my own thing. No, I'm not. I'm doing something that other people are trying to do too.
You're not special, Brenda.
Not in that way. Other ways I am.
You're a diamond.
I am a diamond.
Sparkly
I
diamond.
have many facets.
Yeah.
What are you taking away from our gentle parenting like rundown and conversation?
I think that I did identify with this term more from the beginning. I kind of figured I didn't really know the core components.
Right.
Not really. Like I kind of felt like I probably fell into some kind of like, gentle attachment kind of like, yes, of
halfsies.
yes, of parenting approach.
Sure.
So in going through it, it was just kind of affirming, I think, of what I'm already doing. And also it was, super nice, again, to just always have, I think, validation that even if my child is distressed and struggling and things are hard,
sure,
it doesn't mean that I'm doing anything incorrectly. I just got to like hold on to the roller coaster.
Right.
And try to stay as calm as possible and,
Yeah.
Teach some skills and be as present as I can. And then, like the rest of it's up to her, up to the world, up to
time and development.
There's all kinds of things that impact how our kids develop. It's
Sure.
Parenting obviously is important, but there are many components.
Yeah.
So,
Okay.
yeah.
Well, let us know what your thoughts are on gentle parenting and if this is new information for you or if this is old hat, let us know in the comments. This podcast is intended for informational and educational purposes only and is not a substitute for therapy, diagnosis, or any kind of professional mental health treatment. We hope that we can share with you our experience authentically and genuinely, and we hope that occasionally we'll make you laugh. Maybe you can relate to our quest and how we're psyched for sanity. The content we share is our personal opinions and insights. They are not clinical insights to anyone, and they don't represent or reflect any entity that we work and or have worked for in the past. But if listening to this podcast has made you think, we really encourage you to seek out a mental health professional in your area.